No, I would not vote to repeal the health insurance reform bill. It was a landmark, important bill, even though I would have preferred a different bill. As my constituents know, for the last 6 years I've been advocating Medicare for all, a form of universal single-payer health care, which would have been a lot simpler to enforce, a lot simpler to understand, and I think would have been a better approach. But my view of that did not carry the majority in the Congress. The Congress instead, this House and the Senate, voted for the health care bill that we have today, the health care law that we have today, which is a vast improvement, by the way, a vast improvement over what was going on in our country before. We've now given 32 million Americans who were uninsured, they're going to have the right to get health insurance. For those who had a pre-existing condition and were unable to get health insurance, they'll be able to get health insurance now. For those who had a catastrophic illness or catastrophic injury, who exceeded the cap on their insurance coverage, they had to go bankrupt. And 62% of the people going bankrupt in America did so because they had a catastrophic illness or injury that wasn't covered by their insurance. So they won't have to go bankrupt anymore. Medicare was extended to 2026 for our senior citizens. Small businesses were given all kinds of credits and incentives. And if you have under 50 employees and you're a small business person, you don't have to provide your employees with health insurance. So there are no egregious, in my opinion, health care mandates and obligations. There are opportunities. The government provides incentives to small businesses to provide health insurance to their employees. And there are best practices are rewarded by physicians and hospitals and healthcare providers. Now, is the bill perfect? Is the act perfect? No. Will we be making changes to the law over the years, just like we did to Social Security and Medicare? Absolutely we will. We're going to be refining it year after year. Month after month, hearing from doctors, hearing from nurses, hearing from hospitals, hearing from patients, what part of it is working just right, what part of it needs to be fine-tuned. There are some other elements of the bill that I was disappointed in, namely in the tort reform area. I thought that we could have found a way to create greater incentives against frivolous lawsuits, which cause doctors to engage in defensive medicine and which wastes fortunes of money. But there were some incentives in the bill, and I was happy to see that. And we did get rid of the insurance companies' exemption. You know, the health insurance companies were exempt from the antitrust laws, which was one of the reasons why they took advantage of consumers. Well, we got rid of that, the health insurance companies' exemption from the antitrust laws. And we require the health insurance companies now actually spend 80% of your premium on health care. So the bill does a great deal. Where it needs to be fixed, we'll fix it. But it was a tremendous landmark, like Social Security, like Medicare for our country. Perfect? No. Really good? Yes. And we're going to continue to make it better.